Good morning, everyone. Thanks for getting up early. My name is Steve Warnock. I'm a plastic surgeon. This is not going to stay on. I've been in practice in Salt Lake City for about 25 years. And I'm going to tell you a story. A few years ago, I was doing a breast augmentation surgery. And I was doing them regularly. And I noticed a few things about my own practice. Number one, my reoperation rate was about 7%. I hesitate to admit that because to me that's embarrassingly high. But I was doing this surgery the way I'd been taught. And then a few articles came out in our literature that said that in order to decrease that rate and to improve your outcomes, that we need to do a careful cautery dissection inside the pocket before we put the implant in. So I started doing that. But then I found that the difficulty I had was being able to see inside a pocket, it's about this big around, through an incision this big. And so I started to think about ways that I could solve that problem. Fast forward several years, Lumipen Pro is that solution. And I'll go through a little bit with you about our where we are today, but the long and short of my story is that I've spent a lot of time, effort, money, and resources getting this to this point, and my reoperation rate. 25 years of practice also plays into there, but it's about 1% now. So this has been really helpful to me, and it's very nicely accepted. I will tell you, when we present this concept to other surgeons, it's intuitive. They hold it, they know what it is, they know what it does, and I've had so many surgeons say, I thought of this 10 years ago, and I should have done it then. I said, well, I thought of it 10 years ago, and I did do it, and here it is. This part is the Lumipen Pro. This part is the cautery device. So this is the ubiquitous cautery that is in every OR, every hospital, and the Lumipen Pro makes that device work better. The unmet need is that we have difficulty seeing inside that pocket due to smoke, devices, equipment, retractors, all kinds of things going on inside that pocket. And not being able to see makes it so that the procedure is less precise, tissue damage, that kind of stuff. So that's what we're trying to avoid. With the Lumipen Pro, the surgeon has more control over what's going on inside his field or her field. The device has extension capability here, so you can put a 4-inch extender on this on the cautery, and then suction, hooks to wall suction. Every OR has that. It telescopes out, and at the end here, the suction, and also there's an array of LED lights. So you have light right where you need it. Anyway, it works nicely. So this is our assessment of the market. Electric cautery, obviously we are not selling electric cauteries, but it's a huge market. They are used in every operating room, like I mentioned. Smoke evacuation is an emerging area because it's been demonstrated that surgical smoke specifically leads to higher rates of lung cancer in OR staff. So this is something that has been, over the last 10 years, really evolving. Illumination has always been a problem, is still a problem in the operating room. And one thing that we've learned as we've been pitching this is that there's a whole veterinary side of surgery that really has the same struggles, but we hadn't even thought of that. For this product, our margins are really very good. 80% margins. We expect about $8 million in revenue over the next 5 years, and that includes kind of a ramping up phase because we have some regulatory hurdles that we have to get past. And we expect true profitability in about 4 years, 3 to 4 years. It turns out the more we talk about this, the more specialties say, that could work in my specialty too. Their illumination and smoke evacuation is a problem for not just plastic surgeons, but for lots of specialties. So this is kind of a busy slide, but I think the bottom line here is that we are anticipating as we move into markets, the European market, the South American, Central American market, and through the U.S. where we've already started, we've had a pilot release already of the product, and it's very well received. But as we move past our regulatory hurdles and into other markets, we expect revenue to ramp up pretty quickly. And then by year 4, we should, at that point, start breaking even. To date, I personally have invested, well, it's probably more than that, actually. We have patents. We're FDA Class 1 in the US, and we're working on a Class 2 in the EU right now. And it's been used over 1,000 times. We have about 40, maybe a few more, 40 surgeons that use it routinely. I use it probably 5 times a week. But 40 surgeons that use it routinely and are continuing to order from us. So this is how our investment that we're looking for will start to be used. And this just shows that we've got some regulatory hurdles all down here, but really by this time next year, we should be in pretty good shape. This is just a potential timeline. Just shows that we have a Generation 2 Lumipen Pro with just a few little refinements. It still works the same, but some different refinements that make it work a little bit better. This is our team. It's a small team. We're not trying to build a big company and take this thing to the rest of the world. We are going to do that, but our strategy is to demonstrate the market, do most of the legwork, and then let somebody fit this product nicely into their portfolio. And this is what we're asking for. So 3.1 million would be enough for us to finish our regulatory work, our production setup in the U.S., and then an EU launch, and then just a little extra capital to keep things rolling. So this would be we don't necessarily need 3.1 at the outset, but we could do it kind of in steps as we go. Thank you. Thanks for your attention.